Case recap from today. I had a lady in her mid-40s and we just did a deep plane facelift, deep neck lift, and autologous fat grafting from her thigh to her infraorbital rim and kind of mid-cheek area where she had some volume loss. Interesting things about her case. She is a relatively thin woman, which logistically for surgeons, it's a tiny bit easier to work on those tissues versus someone with a lot thicker cheeks that have just kind of more weight pulling things down. On the flip side, thinner skin can show more contour irregularities. And so I have to be super careful to use small stitches, bury the knots so that long term, once the swelling goes away, we can't see any little suture material underneath the skin. Another thing to note on her fat grafting. So with fat grafting, we're taking cells from one area of the body, harvesting them, so pulling them out, processing them into smaller pieces so that we don't get lumpy bumpies, and then we're transplanting it into a new part of the body. And so we're taking it from its blood supply or its home and allowing it to reestablish a new home and form a new blood supply. And so a small portion of those cells will die. The key with fat grafting is to not overdo it because there's really no reversal. And I often tell patients, it's better for me to slightly underdo your fat grafting, or knowing that long-term we can do more fat or we can do filler, rather than the opposite where we take and we put too much fat in and you feel like you're just overly puffy and you don't quite look like yourself. Tomorrow at her post-op day 1 appointment, I look for several key things. We'll see just overall how she's feeling in terms of nausea or discomfort. I'll look to make sure the skin has good blood flow. If it doesn't, then we start instituting additional healing protocols to encourage the blood to flow into those areas. I'll make sure there's no hematoma or fluid pocket forming. And then the main part of the appointment tomorrow is starting to teach her about incision care, showers, early ambulation to prevent things like blood clots. So yeah, overall case went great. I'm very excited to see how she's looking tomorrow, and then also in about 2 to 3 weeks when some of the swelling starts to really subside.